Now we'll get the real Bridget Walsh, Schuyler Center.
How do you know she's the real one? How do you know she's the real one?
I'm not sure. You're the real Bridget
From one Irishman to another. Yeah.
Thank you very much. Yeah. Thank you very much for the opportunity to comment today on the executive budget. The Schuyler Center is a 144-year-old statewide nonprofit organization dedicated to providing policy analysis and advocacy in support of public systems that meet the needs of disenfranchised populations and people living in poverty. The Schuyler Center often works in areas that fall between multiple systems, including physical and mental health, child welfare, human services, and early childhood development. You have our testimony before you, and you can see that we commented today on a wide variety of topics in the budget, including maternal infant home visiting, investment in community-based health infrastructure, the impact of the minimum wage on health providers, funding for community health advocates, and funding for the transition of adult home residents to community-based settings. I'm just going to touch briefly on a couple of items today. The first is that the executive budget includes $5 million for funding for communities to repair, upgrade, and purchase fluoridation equipment. This investment fulfills a promise that was made last year of a $10 million fluoridation equipment fund. And we appreciate the support of the legislature last year for that appropriation and seek your support again this year. In October, the New York State Health Department released a set of RFAs for the first round of that funding, and the opportunity remains open for communities through February 29th of this year. We understand from talking to some communities that applications are coming in, and we're looking forward to an announcement releasing the grant awards for that first round of funding. Community water fluoridation is far and away the single most cost-effective way to improve oral health, especially for children in poverty. The governor's proposal is a smart, cost-saving public health investment. In fact, in a study that was done by the New York State Department of Health, showed that low-income children on Medicaid in less fluoridated counties in New York needed 1/3 more fillings, root canals, and tooth extractions than those living in counties where the water was optimally fluoridated. But as beneficial as community water fluoridation is, there's large areas of the state where residents do not have access to this benefit. Outside of New York City, fewer than 50% of New York residents on community water systems receive fluoridated water. A recent study modeling practices in New York to prevent oral disease found that raising the share of children outside of New York City who have access to fluoridated water has the potential to save the Medicaid program $27 million over 10 years by reducing the need for fillings and dental treatment. So once again, we ask your support for the funding for this appropriation this year. And I also want to lend our support for the increase in funding to the county health departments. As you heard a few minutes ago, the executive budget maintains the existing base grant and state aid percentage for Article 6 funding to local county health departments. Without a change in the formula, local public health will continue to experience reduced capabilities. As New York State aims to reduce healthcare costs and improve outcomes, in part by focusing on community-based initiatives and prevention, strengthening local public health capacity with an increase in Article 6 funding is a step in the right direction. Finally, I just want to touch on children's behavioral health services. As a result of a long planning process to better meet the needs of children with significant behavioral health issues, the budget includes funding for 6 new Medicaid services for children. And we know that the state will be submitting a state plan amendment to CMS to approve this change. And while the funding is welcome, children's behavioral health care system suffers from a history of underinvestment and a lack of integration with primary care. Children's behavioral health providers are preparing for a transition to managed care and developing the infrastructure necessary for children's health homes. These endeavors require attention and pre-investment that is at least commensurate with the state's investment in adult serving system. We urge you to support the increase for these new services, but would welcome additional discussion on the further investment for children's behavioral health infrastructure. And we thank you very much and are available to discuss any of the items that are in our testimony.
Thank you very much. Questions?
No questions. Thank you so much.
Thank you very much. Lara Castle, Coordinator, Medicaid Matters, New York.
Good evening.
Good evening.
Thanks very much for being here at this late hour. I appreciate it.
Thank you for being here.
As Amy Lowenstein indicated, several of us from the community consumer perspective got together a little while ago and we decided who would touch on what topics. And so some of us are glossing over some topics and focusing on others to kind of tag. Sure.
Speak right into the mic.
Sure. So some of us are, okay. We're kind of tag teaming each other on issues. So Medicaid Matters, as some of you know, is the statewide coalition representing the interests of Medicaid beneficiaries. While there are lots of other interests, as is demonstrated by the fact that we're here into the evening, there are lots of other interests related to how Medicaid debates and how Medicaid budgeting and policymaking impacts on the industry and on managed care plans, et cetera. We are the statewide voice that has come together to represent the interests of real people. In recent years, as you might imagine, we have focused our energies on advocating around the initiatives of the Medicaid redesign team beginning in 2011. And in the last year or so, year to 2 years, we've been focusing our attention on the state's initiatives related to payment and delivery system reform, namely the Delivery System Reform Incentive Payment Program, or DSRIP, as well as more recently value-based payment, which is the state's move to have 80 to 90% of all payment, beginning with Medicaid, be paid on a value basis rather than paying for volume. So we as a consumer community have been very involved in these discussions. We've sit on any number of work groups, and we have, our goal in all of this is to bring voices to the table when it comes to debating these topics and creating new initiatives, bringing voices to the table that represent the interests of real people. So I'm just going to touch on a few initiatives in the governor's budget this year. First, changes to managed long-term care. There are two in particular I'd like to bring to your attention. One, which would change the eligibility criteria from 120 days or more, needing 120 days or more, to needing nursing home level of care. And while the numbers may be low as far as how many people that could impact, our concern is that the local social service districts may not have the capacity to take on the volume of people who could be impacted by this eligibility change. And so I think a keen eye needs to be focused on what will happen to the people who will be impacted by the eligibility change, and in particular what their needs are, because likely they're still high need people, and we want to make sure that their services are provided. In addition, there's a change to managed long-term care as it relates to the transportation benefit. The governor proposes to take the transportation benefit out of managed long-term care, and that may be fine, but we have heard reports, mostly on an anecdotal basis, that the transportation vendor that the state has used over I think, a couple of years now to administer the transportation benefit has not worked well for everyone. And so we would want to make sure that that we pay careful attention to the vendor that provides the transportation benefit, and making sure that people continue to have access to that benefit. As Amy pointed out, there are a number of consumer protections that we believe really ought to be built into managed care. Many of these are not new. There are things that we have brought to the table before that we believe would go a long way to make sure that people are protected in managed care and managed long-term care. So now is a good time a good opportunity to raise those again. For instance, we would encourage establishing a high-need community rate cell to counteract the financial incentive to place people in nursing homes. We would encourage strengthening the community-based long-term care workforce and address workforce shortages in some areas by ensuring adequate wages and benefits. We would urge providing the necessary funding to pay for the new overtime and travel requirements of the Fair Labor Standards Act, which includes providing managed care capitation rates that are sufficient to account for increased costs. And last but certainly not least, there is a significant amount that we believe could be done in the area of oversight and accountability. We would urge you to consider requiring managed care plans to report on any reductions in home care hours and any new placements in nursing homes. We think it's also incumbent on the Department of Health to publish detailed and specific data on grievances, appeals, both internal and external, and complaints to the Department of Health, and fair hearings, because that would give us a better glimpse into access issues as it relates to reductions in hours and placement in nursing homes. And we think that airing that kind of information would help give better insight into what's actually happening in the program as it relates to access. And we believe that managed care organizations should be held accountable for the governor's own goals of the Olmstead Plan, which would require that all people be served in the most integrated setting possible. We join other people who testified today in opposing the elimination of prescriber prevails. Amy spoke about the elimination of the spousal, and others as well, many others as well, spoke about the elimination of the spousal and parental refusal. We also align ourselves with groups who support the Community Health Advocate Program. Amy and others, I know Healthcare for All New York as well, will talk about the expansion of the Essential Plan to cover income-eligible immigrants. My testimony also speaks to the minimum wage impact, which many other groups spoke about today. And while we are a coalition that represents the interests of people, we believe that making sure that the providers who serve people, particularly safety net providers, have all of the resources available to them to continue to do the work that they do, while also employing a workforce that deserves the higher wages. And last but not least, I want to touch on something that we have, as Medicaid Matters, been working on in particular for the last few years as it relates to Medicaid redesign, and that is making sure that community-based safety net providers have access to the same types of funding, in particular capital, IT, infrastructure. There are billions and billions of dollars that have been appropriated in previous years, also appropriated in this year's proposed budget for large institutions, namely hospitals, and we believe that community-based safety net providers ought to have access to that funding as well. Not doing that is really antithetical to the state's own goals in Medicaid redesign and systems transformation, and we would urge you to make sure that community-based safety net providers have access to those funding pools as well. And in addition, community-based organizations, which are non-medical, non-Medicaid providers, but human service type providers, will have a pretty significant role to play in all of this health system transformation work. The state has spent a lot of time through many different work groups and many different discussions highlighting the need for more focus on social determinants of health. And it is the human service organizations that provide food security, vocational training, et cetera, that really are going to be the community-based organizations that lend to helping us reach the good outcomes that are inherent in DSRIP and value-based payment. And without making sure that CBOs have support and technical assistance to participate in all of this, we're afraid that they won't be able to continue to do the work that they have a long history of doing and and that they ought to be able to do that work in order to contribute to the overall goals. So I'll leave it at that and trust that we will have many more opportunities as the budget process continues.
No questions.
Thank you very much.
No questions, but thank you for being a trooper. Lots of good
And
information.
you did it
so
all
thank
without
you.
taking a breath.
Thank you.
Thank you, Laura.
Adam Brizio, Manager and Government Affairs, Center of Disability Rights. Is he here? Going once? Well, he may come back. Bob Cohen, Policy Director for Citizens Action of New York, Healthcare for All New York. Sit on down.
Good evening. In respect of the fact that it's a little after 7 o'clock and a fair amount of what I was going to say has been said by my colleagues, I will be quite brief. And I do want to say, by way of introduction, that if I gloss over things and talk about one or two other things, it doesn't mean that I don't care about those other things, but I want to be respectful of all of your time. So as I think, if people don't know, Healthcare for All New York is a large coalition over 170 organizations of consumer organizations with an interest in healthcare reform. We're the ACA folks and work on many, many other issues concerning consumer access to quality and affordable healthcare. So I'm just going to really breeze through a number of quick things and reiterate what some of my colleagues have said very recently. And just for your information, my organization, Citizen Action of New York, is a member of the Steering Committee of Healthcare for All New York, as is the Empire Justice Center. Amy Lowenstein just spoke, and Bridget Walsh of the Schuyler Center for Analysis and Advocacy is also a member of our steering committee. So we share views on many issues. So just to briefly reiterate, our entire coalition supports the $4 million allocation that Amy talked about for community health advocates. It's an incredibly important program that fills in a gap that is not covered by navigators, the folks that are trained to enroll people in health insurance. My organization, C3, has about 9 navigators, and I can say that we don't have the expertise or the capacity to deal with post-enrollment issues, and that's why CHA is incredibly important. As we have more folks enrolled in health insurance, it stands to reason that there's going to be more people who have not had health insurance that need to be assisted to use their health insurance effectively. I'm not going to, again, repeat what Amy said. She covered it very well about our desire to have $10.3 million for, as she described it, essentially state-funded essential plan for undocumented immigrants, only to add that we believe that this is also a profoundly important moral case that these folks be covered. One thing that I'm going to talk about that I believe has not been mentioned by other speakers is we believe that there needs to be, we're requesting a small amount, and incidentally I'm on page 4 of my testimony, of $2 million to fund community-based organizations and small group business-serving groups to reach the remaining uninsured through outreach activities. As we say in our testimony, there's still about 8% of New Yorkers that are uninsured. We've obviously done a great job collectively in enrolling people, but as we get into where we are now, which is year 3 of the Affordable Care Act and New York State of Health's active operations, it's getting harder and harder to reach certain folks, and we believe one way to address that would be to have a small but effective grant program that would address situations where navigators either can't or don't have the time to reach certain communities, such as rural New Yorkers and people whose first language is not English. And I just want to, actually I have 2 things to say in conclusion really quickly. Our entire coalition shares our colleagues' view that the legislature should once again reject the governor's proposals to eliminate spousal refusal and to repeal prescriber prevails. We know you've been doing that the last few years. We praise you for doing that, and we trust and hope you'll do it again. And I just want to make one last statement, and I'm quite frankly using my hat as Citizen Action of New York. It doesn't necessarily represent our entire coalition, not because our coalition has rejected this position, but because we haven't discussed in our coalition. Obviously, many providers have talked about earlier today about the impact of an increased minimum wage on their operations. It's certainly not something we're going to deny is true, but from an equity standpoint, it seems to us that the most rational approach would be to provide the adequate funding so these agencies, at the risk of saying the obvious, the state should provide, in our opinion, the funding these agencies need to pay adequate wages rather than continue to have employees that are dependent on public assistance who are on their staff. Thank you.
Thank you.
Thanks.
Thank you. Henry Garrido, Executive Director, DC 37.
Good evening. I want to thank you all for your leadership and for sticking around. Long day. But I like to think that you left the best for last. So if I can have a moment of your time, I will respectfully not go through my testimony, but actually want to just take a moment to highlight some of the most important, more salient points that you see in respect of your time and that of everybody else's. I'm Henry Garrido. I'm the Executive Director of District Council 37, the largest municipal union in New York City. We represent about 18,000 workers in the hospital system and about 4,000 in the Department of Health and Mental Hygiene. And I won't mince any words here today. Quite frankly, we need your help. The workers need your help. Over the next 2 years, the health and hospital will be facing $1.2 billion in deficits. Now, I'm usually skeptical of announced deficits because I believe that numbers are used to lie repeatedly. But this time, we've actually looked at these numbers and found them to be accurate and true. And despite the last week's announcement by the city that it would pour in an additional $337 million to try to eliminate the deficit, the honest truth is that with the changes into the healthcare law in the industry, the health and hospital system could not and will not survive without your help. And what we're asking for, quite simply, is equity, is fairness. You cannot have 80% of the uninsured patients in the borough of Brooklyn be serviced by a hospital system that continues to be underfunded. So first, I want to take your attention to the indigent care pool. Whereas $3.5 billion of distribution of funding goes from the state distributed throughout the state, our health and hospital only receives $96 million of that, despite covering 50% of the patients in the emergency rooms. That is unfair, and it's inequitable, and needs to stop. Now, we're not begrudging any voluntary hospitals for the work that they do. I think they do a great job sometimes. But the fact is that the hospital system continues to provide 40% for the mental care in New York City, throughout the state. $96 million is just simply inaccurate. And we need your help to try to make that system more equitable. Second, safety net definition and dish funding. As you know, things are changing continuously in New York State in terms of funding. But we need a formula that better reflects and follows the patient. So I want to thank Senator Hanna for his leadership and great work in education in this process, particularly on the vital access funds that we need in New York. I think that definitely, if there's a place where you underscore the kind of inequity we're looking at, this is one. And as you know, the state is going through a major reform through DSRIP. And we've been in consultation with our sisters and brothers and with the Health and Hospital program. And we would like to be part of the major reforms that One City Health is continuing to do. But the fact is the funding still remains inadequate, $800 million short. And their expectation is that you have to train 10% of the city's workforce and their workforce throughout. So that combined with a $400 million shortfall committed, we believe creates a structural financial deficit for the health and hospital system that's providing the majority of care for the patients. So I want to thank you for listening today and for the long hearing, and again, for your great work. But New York City helps you, and so do we. Thank you.
Thank you very much. Questions? Thank you. We will adjourn.